of discussion is on the hand hygiene. Hand hygiene is also known as hand washing. Okay, let's discuss what is it. Okay, here you can see this is the contaminated hand and this is the clean hand. If you give shake hand to the clean hand with this contaminated hand, you are giving your infection also to that person. Like this is the exposure and the transmission of infectious disease. Like now you can see here this clean hand becomes infected hand now, contaminated hand, isn't it? Okay, so let's discuss hand hygiene. You all know that the hands are the most common vehicle of transmission of organisms. Clear? So the hand hygiene or a hand washing has been recognized as a single most important way to prevent the transmission of this infectious agent. Okay. So did you know that what is the best and the cheapest method for the prevention of infection? Yes, you're right. It's hand washing. And he is the man. His name is Dr. IGNEZ SEMMELWELS. He is the father of hand washing. He is the man who taught us about hand hygiene. Okay. Then you all know that hand washing, also known as hand hygiene, is the act of cleaning hands for the purpose of removing soil, dirt and microorganisms. Microorganisms means bacteria and viruses, which are the disease causing germs. So you use your hands for almost everything, isn't it? So they are easily contaminated. Hand hygiene or a hand washing is the easiest and the most important way to prevent the spread of infection. Clear? So what is it? Hand washing. Hand washing, also known as hand hygiene, is the act of cleaning one's hand with the soap and hand wash and water. Why? For the purpose of removing the soil or the microorganism. Microorganism means your bacteria, viruses. These all are the disease causing germs. In order to prevent the cross infection, cross contamination and minimize the nosocomial infection. Nosocomial infections means hospital acquired infections. Clear? Then what is the purpose for doing this hand washing? First, to clean the contaminated hands. Second, to remove dirt and soil from the hand. Third, to minimize the number of microorganisms. Fourth, to prevent cross and nosocomial infection. Nosocomial means hospital acquired infections. Fifth, to break the chain of infection. And sixth, to control infection. So these all are the purposes for doing hand washing. Next we will discuss what are the types of hand washing. See, there are three types of hand washing. First is social hand washing. Second, medical hand washing. Third, surgical hand washing. Social hand washing means simple hand washing which we all do. Okay. Like before eating, after using toilet, simply we'll wash our hands. This is known as social hand washing. Whereas medical hand washing means you have to wash your hands with a soap or a alcohol based hand rub. But there is some time limit for this medical hand washing. Medical hand washing we usually do for the 30 to 40 seconds at least. And next is our surgical hand washing. Surgical hand washings are usually done by the surgeons, especially before surgery. So this surgical hand washing, its time limit is 3 to 4 minutes. Why there is a time limit? Because what you actually do in this hand washing, you are rubbing your hands, isn't it? So when you rub your hands, you are making a friction. So with friction, what you are exactly doing, you are washing off the maximum pathogens. Pathogens means disease causing germs out of your hand. So that is why there is some time limits for a particular hand washing. Like in medical hand washing, you have to do at least 30 to 40 seconds. In surgical hand washing, you have to wash your hands, scrub your hands at least 3 to 4 minutes. Clear? Next, we will discuss, according to WHO, the 5 critical times during the day where the washing hands with the soap is important to reduce the fecal-oral transmission of disease. What are they? First, after using toilet. For urination, defecation, even in the after the menstrual hygiene and all, what you have to do, you have to wash your hands. Next, after cleaning a child's bottom, that means after changing the diaper of the baby, you have to wash your hands. Then before feeding a child, you have to wash your hands, okay? Or before eating, and before or after preparing food or handling the raw meat, fish and poultry, what you have to do, you have to wash your hands. Next, 5th is before or after treating a cut or a wound, after sneezing, coughing, blowing your nose, after touching the animal waste or handling the animals, and after touching garbage, etc., what you have to do, you have to wash your hands. So these are the 5 critical times during the day when you have to wash your hands with soap. Clear? It's very important. Then next, what are the equipments you are needed for this hand washing? First is the sink with the warm running water. Second, tissue paper or a small towel to dry your hands. Then trash can and the nail cleaner to clean your nails. Then is the soap dispenser or a soap dish, soap and the soap dish. Okay. Then what are the steps and the movements of the hand hygiene? Here you can see there are total 7 steps. First is palm to palm. In palm to palm, what you have to do, you have to rub your palms together. And second step is the right palm over the left dorsum and vice versa. Here you can see what you have to do, you have to rub the back of both hands, like left hand over the right dorsum and the right hand over the left dorsum. So dorsum means back of the hand. Clear? Then third is interlacing. Here you can see what you have to do. You have to interlace the fingers and rub the hands together like this. Then is interlocking. Fourth is interlocking. What you have to do, you have to interlock the fingers and rub the back of the fingers of the both hands like this. Okay. Then is base of the thumb. Here you can see what you have to do, you have to do the rotational movement of your thumb. Rub the thumb in a rotating manner followed by the area between the index finger and the thumb for both hands. Like that you have to clean your thumb. Then tip of the fingers. Here you can see again there is a rotational movement of your fingertips. That means you have to rub the fingertips on the palm for both hands. Clear? Then last step is the up to the wrist. What you have to do, you have to rub both the wrist in a rotating manner, and last is rinse and dry thoroughly. So these are the 7 steps of hand washing. Clear? Next we will discuss what are the facts related to the hand washing. First, research shows that the washing hands with the soap and water could reduce the death from the diarrheal diseases by up to 50%. Okay. Hand washing can reduce the risk of respiratory illness like cold in the general population by 16 to 21%. Clear? And third, a large percentage of the foodborne diseases outbreaks are spread by contaminated hands. So hand washing can reduce the risk of foodborne illnesses and the other infection, isn't it? And last is the researchers estimated that if everyone routinely washed hands, 1 million deaths a year could be prevented. Clear? So hand washing is very important. Thank you. So today we have discussed about the hand washing, what are its purpose, and what are the steps of hand washing, what are the types of hand washing, etc. Hope this video is clear to you all. Thank you.